When one is first diagnosed with CLL, sometimes patients have been told that they have lymphoma, and usually what they're referring to is what's called small lymphocytic lymphoma, SLL. Well, SLL and CLL are really a spectrum of the same disease. For whatever reason, some individuals present with an increased white blood cell count, an increased lymphocyte count, and if it exceeds a certain threshold and has the features of CLL that I mentioned by our testing, we call it a leukemia. Leukemia is a cancer of the blood and the bone marrow. Now, some individuals can have the exact same cells with the exact same markers, but they're not in the blood. Maybe it's a lymph node biopsy where the diagnosis is established, or even a bone marrow biopsy. But if there's no increase in those cells in the blood, then we give it the name small lymphocytic lymphoma. So unfortunately, I think this creates more confusion than anything else, but the message is that we treat these the same. SLL and CLL, we use the same treatment approaches, we use the same drugs. Our clinical trials with the novel agents have included SLL patients. The approval for these drugs includes SLL, and SLL is not a typical low-grade lymphoma. That's a different disease, and that's treated in many cases differently. So if you receive that diagnosis, your focus should be on how do we manage CLL, because we treat it the same way.